This scan can identify all of the vibrational frequencies that are meant to be in the body given the gender and the age of the person. So I'm looking into, say, the liver. The liver should be expressing a certain vibrational frequency. But it also picks up all the things that should not be there.
Hello there, good morning, good afternoon, good evening, wherever you are listening from around the world. Welcome to the official Truehope Canada podcast. My name is Simon, I will be your host. Truehope Canada is a mind and body based supplement company that is dedicated first and foremost to promoting brain and body health through non-invasive nutritional means. And our current series of episodes on this podcast is discussing how different therapies, practices and practitioners apply their profession to the huge topic of mental health. For more information about Truehope, you can visit us at truehopecanada.com, and you can find us on Facebook and Instagram and all the usual places. We've got another amazing guest with us today, Cameron Moffatt. Cameron is an osteopathic practitioner working and living in Victoria, British Columbia. I've personally had the pleasure of learning from Cameron during my holistic nutrition training, and for me, having him on the podcast was essential. So, first of all, thank you for joining us today, Cameron. How are you?
I'm very well, thank you, and thank you for having me on the show.
That's awesome. I wonder if we could just kick off and you just tell us a little bit about yourself and your journey into becoming a osteopathic practitioner and healer.
Yeah, thank you, Simon. I've always been really curious between the connection between your mental health and your brain and your physical well-being. I started off as a marathon runner back in my 20s, and I noticed that what I ate seemed to have a big impact on my performance. And that led me then into going into massage therapy, recognizing that was somewhat limited in what I could achieve. I then went on to get a diploma in osteopathic manual medicine. From there, I realized after about 4 or 5 years that I was again still only dealing with the physical. And so I started looking into the whole world of vibrational medicine. And that led me into eventually being treated by and then purchasing something called an ETA Scan, which is, there's numerous different units on the market now, but an ETA Scan works in the original teachings of Rife, so Rife machine. Essentially what you're looking at is vibrational medicine, how you interact into the cells on a subatomical quantum field level and change the vibration of that cell's expression.
Wow! So through this scan, through this machine that you would do with somebody, you can tell a heck of a lot about what their cells are doing and what their body is ultimately, what kind of physical state they're in energetically. Yes,
this scan can identify all of the vibrational frequencies that are meant to be in the body given the gender and the age of the person. So I'm looking into, say, the liver. The liver should be expressing a certain vibrational frequency. But it also picks up all the things that should not be there. And it doesn't just pick up a vague vibration. It actually identifies right down to the name of the actual virus. So it'll actually show me that there's a Coxsackie B24 virus present in the liver, or there is heavy metals, mercury. It'll also pick up streptococcus, and on and on and on. It also picks up the emotions. So if the person is dealing with a heavy degree of anger, emotions have expressions of vibration as well. And so it'll pick up an excess amount of the vibration of anger or fear or whatever. And then what's really interesting is the scan can then, using the law of resonance, which states if you have a sine wave of a particular anything, if you invert that sine wave and put it back into the original sine wave, it cancels each other out. It's how the sound canceling headphones work.
Okay.
All right, same principle. Or if you ever watched a movie and they talk about jamming the police radar, that's exactly what that is. You catch the radar signal, reverse it, send it back out, and it cancels it. So I can use the ETA Scan to I'll identify the particular pathogen or the toxin that's causing the problem in that area, identify that sine wave, reverse it, send it back into the body, and it cancels that wave out. In other words, if it's a living thing like a virus, it kills it.
Wow, that's awesome. I'm a little bit familiar in regards to like the energetic and frequency piece that you're talking about when it comes to the liver's going to have its own frequency as well as other organs and cells and tissues. Can you explain a little bit, maybe a bit of like a fundamental in regards to all of that? The energetic piece that's working within the body, because I think maybe using the words of like energy and frequency, maybe a lot of people are not like understanding or connecting with that.
Well, it gets into a bit of a rabbit hole of quantum mechanics. So when we talk about a remedy or a piece of wood or anything, any material substance in the world, what are we talking about? Well, we're talking about what we can actually tangibly feel, but then we're talking about molecules, and underneath the molecules, we're talking about atoms, and then underneath the atoms, below the atoms, science has identified it's all pure energy. So when we look out at the world and we see the world, yes, we identify all these solid things that we see or touch or feel, whatever it happens to be. But underneath all that is vibration. The classic example of that is we get onto a cell phone nowadays. We can speak to somebody in New Zealand almost instantaneously. Well, how's that working? Well, it's working essentially in vibration. It's pure vibration being transmitted and converted back into a form that our brains we call language. Cells in the atomic field are expressing vibration all the time in the body. And when they're in balance, you have health. When they're out of balance, you have dis-ease.
Yeah, I think that's truly fascinating. And I think that with a little bit of understanding and reading, anybody can kind of get a little bit more of an understanding of kind of how that works. And I think that's truly fascinating. Is that when it comes to mental health in your practice, is using this machine, so it's ETA?
ETA, ETA. It's a short form for the word étalon, which in the French language means transfer of information. So étalon was adopted by the microwave industry to denote moving data, our voices, through the air in a microwave cellular field.
Great, yeah, and just because we can't see, feel, taste or touch something, it obviously doesn't mean that it's not there.
Right.
And there's energies and frequencies working right now in the technological industry.
Constantly,
obviously constantly. So when it comes to, it only makes sense that technology meeting biology and using these means to help people diagnose and help people understand a little bit better through obviously the whole process that you most likely have. Can you tell us a little bit more about the information that you would gain from doing this test and how that a client of yours can actually see it and maybe recognize what they're visually seeing through this test with what they're internally feeling?
Sure. So one of the things I've been taught, and I really hold very strongly in my mind when I am meeting somebody and assessing, every dysfunction has a reason. Whether it's emotional or whether it's physical, there's always a reason. Now, when you get into the emotional and mental health, somebody could be has been subjected to a large amount of trauma in their past, or 6 months ago, their house may have burned down, they got divorced, and their dog died. Just way too much trauma. So what will happen then at that point is the brain will start to change its chemistry. This has been researched and proven over and over again that trauma will induce a brain chemistry change. Well, the minute that happens, now you're starting to change the information that's going into all the cells in the entire body. If you get into a state where your hypothalamus, which is the master gland of the endocrine system, becomes dysfunctional, in other words, the person's no longer sleeping properly, they're not reacting to stress in a, quote, normal way, there's a very good indicator that the endocrine system is right out of balance. And the typical phrase that's used is adrenal fatigue. Now, I don't believe in adrenal fatigue anymore. The adrenals are one part of a very integrated system, and the hypothalamus is essentially the master gland. The adrenals are kind of like foot soldiers. They can't make any decisions really on what to do. They're just told what to do. So when a person gets into a state where they're no longer sleeping properly, that's indicating that the brain's not functioning properly. So from a mental health point of view, then when I'm doing the scan, I look at all that endocrine system. I look at the adrenals, I look at the hypothalamus, I look at the pituitary. Are they functioning together properly? And if they're not, there's going to be a reason why. Now, if somebody is forthcoming with me and says, Cameron, I've been under a lot of stress the last couple of years, or as a child, my home life was not very nurturing. Or I've had people say to me, when I became a teenager, high school was brutal on me. I did not have a good time in high school. It was very rough for me. And when I became in my 20s and started to become an adult, I noticed I was always struggling a little bit with stress. Those were all indicators that even though it started off as a mental thing, it's now become a physiological thing as well. And that's exactly where I can help them. I'm not a counselor, so I don't get into the counseling. I have a very good network of other practitioners that I would refer that person to for help if they're not already receiving it. But on a treatment point of view that I can do is that I go into those physiological areas and try to get them back into balance to help them on their journey of finding more peace with whatever it was that started the original problem.
Yeah, that's fantastic. And just having a thought, I think a lot of people will recognize and understand that, traumas and stresses, we suppress them and we take them internally. Is there a way you can kind of translate that for me in regards to the energy and the frequencies and how the frequencies change within, let's say, damaged or incoherent systems?
That might be a little bit longer than this podcast, but sure, I can, in a nutshell, for example, let's say somebody is struggling with some either historical or present stress, and they recognize that they're not functioning as well as they'd like. They're having trouble at work, they're having trouble in their relationships, they're having trouble with their children, etc. That person, I can almost guarantee you, Simon, will not have a balanced digestive system. That person will not have a digestive system that is taking in the nutrients, absorbing them, and eliminating the toxins properly. So again, I can go into, with the scan or with my manual work, I can go onto the person's digestive organs manually and palpate whether or not the stomach, the small intestine, the liver, large intestine, and the pancreas are functioning properly. And you can feel that. You can feel it either manually in that work or in the scan. I can go in and actually test those organs. And if those organs are not functioning properly, the scan will pick up right away very low frequency of energy. It'll say it's running at 20%. Then what I can do is go and look in the list of it gives me quite a large list of pathogens. My job, my skill set is to pick out which ones I think might be the problem.
Because there are obviously going to be different bacteria and viruses present naturally anyway.
When people see what's inside us, it's mind-boggling. Some people get quite disturbed by it. I was at a conference 5 years ago, and they presented a study done by the Americans and the European Union. This was the World Health Organization released this study. They wanted to look at the average number of toxins a person was coming in contact with on an average day, looking at food, water, and air. You want to guess the number?
A day?
In one day.
I will go with 1,100.
56,572.
Okay.
Of which only 2,000 had been studied in a lab for their effects on human beings.
Wow.
Now, as any chemist will tell you, and as the presenter pointed out in this conference, when you take a chemical that's been studied in a lab, one chemical and another chemical, and you say those are not harmful to human beings, but then you throw them out into the environment and they swish everything together, you've got a brand new chemical. So the presenter was very clear on this, that we are in a wild west right now of health care because of the toxic load on our planet.
Absolutely, yeah, that's a crazy number.
It's a crazy number, and that's every day. So every day your liver and your kidneys have to process those chemicals and get them out of your body. Now the problem is our immune system, which is the second layer of your digestive tract, doesn't recognize things like mercury, diazepines. It doesn't recognize anything that is not organic. So it does recognize the viruses, bacteria, some molds, although often molds are a problem as well, and many of the parasites it can deal with. But it doesn't recognize everything else. And so it stores it in the body. And then when it starts to store it in the body, if those chemicals end up in your brain, guess what's happening to your function of your mental health?
Yeah, it's going to be all over the map.
It's going to be all over the map. Yeah, exactly. And the scan can go into the cerebellum, it can go into the cerebrum, it can go into the brainstem. I had a mother call me up recently who I'd worked with using the ETA Scan, and she asked me if I would look at her daughter, who had been at the age of 9 just recently diagnosed with dyspraxia, which is essentially the inability to stand up and move without falling over. There's a real imbalance issue going on. And when I further asked the mother for some details, she mentioned that this child had been born basically angry. was always angry, had not been functioning well at school, didn't get along with the other siblings very well, and was a real concern for the family. So you could label that as a mental health issue.
Sure, it would be in conventional means.
On the scan, right away I identified so there's some things that you can tolerate fairly well in our bodies, and there's some things we can't tolerate very well. And one of them is the herpes virus. The herpes virus is nasty. It really can cause a lot of problems. And people think you have to have an outbreak of shingles, chickenpox, or cold sores. And that's actually not the case. I'd say half the cases of herpes that I see are internal. People they just know they're not feeling well, or they've got a rash, or they've got a burning sensation in their gut. Anyways, this child was full of herpes in the brain, the brainstem, the eyes, the ears, and the entire spinal cord.
Wow.
So when I went into the chromosome, so this ETA scan goes into the chromosomal level, and what we're looking at at that level is the information that your parents gave you at the moment of conception. So mom comes in with her DNA, dad comes in with his DNA, and then you come in with whatever you want to call it, soul, spirit, God energy, or just essence, whatever. Those three things then form a human being. But when the DNA comes in, remember those 56,572 chemicals, they get passed on from generation to generation. Right? When you're birthed, you collect what mom and dad gave you. That'll be the DNA code, but also the junk. Well, this child picked up the herpes virus at the moment of conception and in utero. The mother had that problem. That's why I was originally working with her. And this poor kid was born basically with a headache.
Wow.
Okay. And not functioning well. So can you label that a mental health problem at that point? Yes, it is, but it's also not only a physiological problem, but it is an inherited ancestral problem at that point. And the scan allows me to work in the ancestral field as well.
So as a treatment plan for something like that, that's obviously not something that's going to be fixed in one session. Something that's been going on for
it won't be
years.
Fixed in one session. The scan is very efficient at knocking back the virus. So again, remember the law of resonance. The scan picks up the frequency of the herpes, inverts it, sends it in, and starts to kill it off. I also have the ability with the scan in the scan unit, there's about 380,000 remedies. They've all been digitized. Everything on these shelves that you see of my remedies, they're all in that machine. So then I can actually type in the remedies I know that are antiviral. So in this case, I used a plant-based remedy as well as a homeopathic-based remedy that are antiviral, and use them on the child as well. And it just kept knocking it back.
Yeah. It
kept knocking it back. So then afterwards, in conference with the mother, I put the child onto these two remedies to go home with, and they'll be on those. They were on those for about 6 weeks. And then the idea is to reassess at that point and see where the virus is going. The telltale sign will be, of course, how the child's behaving.
Sure.
And within 3 days, she called me back and said, "Oh my goodness, I actually have a happy daughter. She's starting to smile a little bit." And I said, "Well, of course she is. She doesn't have a headache anymore."
That's crazy.
Yeah.
Yeah, and there must be so many cases out there that obviously a lot of people are completely unaware of this type of treatment.
Mm-hmm.
And as you say, in regards to people getting like the classic examples of like mental health that we have, where a child comes into a doctor's office and they'll go through the kind of like a checklist, and then maybe leaves with a diagnosis and a prescription, and that's the really limiting belief that we hold when it comes to the conventional treatment of mental health.
Yes.
But this is looking at a completely different aspect. First of all, it's going back to the beginning of that person, taking into consideration so much more, and then using the technology to be able to look at the abundance of certain viruses or bacteria. And I think, again, a lot of people don't understand that we have this microbiome in our gut of this absolute arsenal of good, bad bugs, whatever that really means. Mm-hmm, but then we also have the virome, where we have clusters of viruses that are engaging and interacting with each other and with our bacteria and our own human cells. And we are so far from a sterile internal environment.
No, not at all.
So far from it. And then a lot of the things that we do to think that we're staying clean actually really damage something that has been, we've evolved with forever.
Right.
Yeah.
That takes us into something we were speaking of before we started. This whole isolation that we're being asked to do, and the mask wearing we're being asked to do. I have seen more cases of big viral infections of herpes, Epstein-Barr, and cytomegalovirus. I've seen more of those in the last 2 months than I've seen in my entire career. And the problem is right now is we are weakening our immune system by this isolation. Our immune system functions on being challenged every day. It's like a fire department. You have a fire department that doesn't get a call for 5 years, and these guys sit around and they play cards all day, and all of a sudden they get a fire call 5 years later. They're going to run around and bang into each other. Yep. But you keep the fire department up by training every day. We are not training our immune systems right now. We're letting it get a bit weakened. And when that happens, many of these pathogens, whether they're viruses or bacteria, are opportunistic. They notice there's nobody at the gates right now of the immune system, or not as many helper cells, T cells, etc. And so these viruses are now trying to take advantage of it. The other thing I'm noticing too as well, the act of us washing our hands with all of this alcohol, we have streptococcus and staphylococcus on our skins. It's supposed to be there. It's part of the protective barrier. When you cut yourself and a bit of that bacteria gets into your skin, the immune system handles it no problem, kills it off, and makes sure it doesn't go internally. When a child is born through C-sections, what they've now researched and proven, if that child is brought out of the womb through a C-section and placed on the mother's skin right away, that child then starts to adapt the indigenous skin bacteria, which is streptococcus and staph, and that is not a good thing. No. So what they do now is they swab the child with vaginal excretions before being placed on the mother, and then that becomes the indigenous bacteria, which is what it's supposed to be. So going back to washing our hands with all of this alcohol, strep and staph, like anything else on the planet, want to survive. And the minute they start sensing all this alcohol on the skin, they go internally. It'll push itself into the skin. And I've been noticing now people coming in with strep and staph infections that I've never seen before.
It's really interesting, yeah. And obviously not just the fact that we are isolating more, meaning we're moving our bodies less, we're not doing the sports that we used to do, we are inside more, so our vitamin D and sunlight levels are going to be decreasing. All of these things play into it. I'd just like to ask you about the mask idea, because of obviously we wearing this mask, and we breathe out not just to get rid of carbon dioxide, but also to get rid of toxins, and it's one of our primary methods of getting them out of our body.
Right. And
if we have this this mask, this filter, this block that allows these things to, some of them obviously are going to pass through this filter, but a lot of them are going to, congeal and stay in this area, and an area that is just, a really sensitive one for humans, like this, our mouth, our nose, these mucosal areas, how dangerous it is for those different microorganisms to kind of cluster in that area when they are clearly supposed to be exiting far from the body.
Well, you're getting into a two-fold question. There's a political answer to that, and there's also the physiological, science-based answer to that. And of course, you're right. We are trying to constantly breathe out toxins. I understand in society right now why people want to wear a mask.
Me too. I understand.
They feel safer with it. The science doesn't show that, though. The top 3 virologists of the World Health Organization were quoted in an article not more than a month ago, and I actually read the article, stating that they felt very, very strongly we had to stop with the masks, that they were causing more damage to the population than what it was worth. So when I read that, I think, well, I'm not a virologist, I'm not that level of a scientist, but I do trust. You have to trust somebody. So I'm going to trust the people who are using science. And they're all saying, and doctors are coming out all over the world right now saying, we got to stop this. This is actually causing more damage. I know on the scan, I've had the opportunity to work with several nurses who all of a sudden, previous to COVID, they were being told the surgical mask that they were wearing, they were supposed to use it one patient and throw it away. One patient, throw it away. When COVID hit, they were told to wear the mask all day. And now many of them refused. I was told they were throwing them away at lunch hour, so they're using 2, but still it's 2 per day instead of 1 for each patient. And in a number of these nurses, I started finding various petroleum-based nylon chemicals in their lungs. And
Wow.
a couple of them I've been working with for maybe 3 or 4 years using the scan. And so I had an idea of what they typically had. And all of a sudden they were coming and saying, I'm not feeling very good in my lungs. I looked in the lungs and a couple of the chemicals, I didn't even know what they were. I had to go look them up. And I realized these are chemicals made by the fabric industry to make nylon, rayon, polyester, et cetera, which is in our masks. So I think if I'm asked at the office what to do about that, if you're in a group of people, wear a mask. But if you're out running, or you're sitting in your car by yourself, or you're out walking around, the science says that's not at all how you're going to catch COVID. So take it off, and make sure you're breathing. Like during the day, try to get out somewhere where you're by yourself or around people that are in your bubble, and breathe really deeply.
Yeah, I think that's really good information, and I've personally experienced a lot of people who have actually taken this last year or 9-10 months to actually go internally a little bit, because their external world has been decreased a little bit. They're not going out and doing the same things, seeing the same people, where they've actually had to reassess themselves a little bit, and it's actually given them actually a really great place to come from when it comes to making like active, healthy changes.
Yes.
But I've got a question for you. I wonder how interesting it would be, as I say, you've seen these particular viruses pop up that you've not seen before in your patients over the past few months. I wonder how many of your colleagues would have seen the same types of things, the same types of pathogens creeping up in these scans, and the same types of patients coming in with similar things that you've not seen before.
Yeah, good question. About 2 months ago, I was beginning to think that I was either creating all of this or somehow subconsciously looking for it. So I reached out to a few people that I know, and they concurred. It is in my field, whether it's in energy medicine or manual medicine, people are getting sicker. Now there's 2 groups that I've been sort of seeing, and I asked these other practitioners that I spoke with, and they sort of said the same thing. Like you mentioned, Simon, there is that group of people that are embracing this time and going, you know what, I can't do what I normally do, so let's go inward. Let's do some work on myself. Let's figure out my relationships, figure out who I am. Let's learn to play the guitar.
Sure.
But I also noticed there's another group are having a very hard time with this, and they are typically drinking a bit more. They are staying up later. They're not doing their exercises. Their relationships are suffering a little bit. And that's the group I'm finding where the immune system is not as robust. And as a consequence, then these viruses are showing up more in that group. The other group has been interesting to work with as well, because as these people dig into their own mental health, their own psyche, their own patterns that they use throughout the day, even though it's a very positive exploration, there's some bumps along the way. And so one of the things I offer in that group is I use a lot of homeopathic-based remedies, and I use a type of remedy called an UNDA, U-N-D-A, and they're somewhat unique in the world. They're not really homeopathic, and they're not really plant-based. Where UNDAs are different is they have the ability to go right inside the cell and right into what's called the mitochondria. And in the mitochondria is your maternal DNA. And that DNA's responsibility is to make sure that that cell replicates into the same kind of cell. If that cell goes into something goofy, we typically call that cancer. What's interesting for me is cancer is not a thing. Cancer is an event. And it's the end of the events. I've been taught there's 5 levels of penetrations of toxins into the body. The 5th one is right into the mitochondria, where the cells then dysregulate. And for lack of a better word, we call that cancer. So when somebody starts to dig into their own personality and challenge some of the patterns they use, with enough persistence, you can get down into the epigenetic field. You're starting to question and challenge the belief systems you have on how I feel. Well, when you do that, you're getting into an area where for a little while you will be in an unknown. I have this old pattern, I don't want to use it anymore, but I haven't quite created the new pattern. And in that period, it is stress. It's stressful for the person. It's like standing on quicksand for a little bit of time. So when I work with people like that, then I use these different remedies to access that level and help them work out. If they're forthcoming with me enough, they can tell me what their emotional feelings are, and then I can, in my training and in my own intuitive self, figure out what that might be like physiologically. what systems in the body are being challenged by this belief system that they're trying to get rid of. And then access into that system, whether it's cardiovascular or endocrine, often it is the endocrine system, central nervous system, and then use these remedies to access there and help them clear it out.
That's great. And I think, that unknown that you're talking about is a very delicate place for change.
Mm-hmm.
Do you see a lot of people step into that quicksand and then jump back out because it is, the unfamiliar and the unknown is quite a scary place?
Has one of the things I believe is my job that I really believe very deeply in is to help them not jump out of it, but also make sure that they're still functional. There's a fine line there. I had one lady call me up one day that I was doing just this work with, and she said, "I want to kill him." And I knew who she was talking about, and I said, "Well, should I be calling the police?" And she said, "No, but I still want to kill him." I said, "Okay." And we talked it through. It was like a 5-minute conversation, 10-minute conversation. By the end of it, she was laughing. She had accepted her anger. She recognized it was very appropriate. She had a right to be angry. And out of that anger, because of the impetus with anger is its movement, she then, later on told me, sat down with him, had a long conversation, and started this whole change in their relationship. And that was 8 months ago, and they're now doing far better.
That's amazing. And yet obviously using something like anger is a really good example, because I think everyone's very familiar with the sensation of that.
Mm-hmm.
And there's a big difference between becoming angry and then just suppressing it,
right,
and creating a coping mechanism, whether that's like, I don't know, running or eating or whatever that might be.
Mm-hmm.
And then actually experiencing the anger, recognizing it and digesting it through a process of usually communication.
Right.
There's a big difference between those two things. And from what I've understand and learned this morning, is that is going to within the frequency and the energy of what anger means, and that's going to change you at energetic subatomic level.
It will, absolutely will. And very good point too, Simon. How you deal with that anger really dictates then, the next moment how you change your patterns. I'm not a Buddhist, but I have studied a lot of Buddhism. And, the Buddha was able to prove in his way, and now in the quantum field, they've proven in a science way, that we are creating our reality moment by moment by moment. I forget the exact number of microseconds it happens, but the analogy is often like given as a fluorescent light bulb, how it flickers back and forth, back and forth. Well, we're doing the same thing. We're recreating our future moment by moment. And so how the person deals with that anger in that moment dictates the next moment. And if you can help somebody either through talk therapy or remedies or just a nice conversation and help them get out of that, of creating more anger in the next moment, then that to me is real medicine.
Absolutely, yeah. Creating that type of change where somebody is going to start thinking, feeling, and behaving in a different way, and usually in a way that's unfamiliar to them.
Mm-hmm.
But because they've experienced that familiar anger, we'll call it, they don't want to be like that anymore. No. They want to change, they want to recognize, but there are absolutely tools and ways that we can do that. And every single moment is an opportunity to think, feel, and behave in a different way.
That's right.
And I love the connection with the energy,
mm-hmm.
with
mm-hmm.
the frequency that we have within our bodies. I'd just like to step back into the osteopathic side of things for a second, and I just wanted to discuss what does an initial session look like for you?
Okay.
If someone comes in to see you.
Yeah, my initial sessions are an hour and 20 minutes long. So when they come in, there's an intake form which I send them in advance, and I always appreciate if they can fill it out beforehand. I'll come in the morning before I start, and I'll review any new cases coming in, get a sense of what's maybe going on, get some ideas. And then when they come in, we start talking. And I really sort of follow initially for the first 15, 20 minutes of where that person needs to speak. Sometimes it's purely physical. Sometimes it is, they recognize that there's an emotional state that's causing some of the physiology. I'm always very interested in that. And then after about 15, 20 minutes, I start to get a sense of possibly what I'm dealing with, where we need to go. I have the person stand up, and I do a technique that's called listening, where I put my hand on their head, and I basically put a little tiny bit more stress or gravity into their structure, and I wait to see what the body tells me. Often the body will start to then move, shake, twist, hiccup, something will happen. And depending on where in the body it is, it'll help me then focus a bit. Okay, so we are dealing maybe with a liver issue here, or there is something in the mid-thorax area. Maybe that's the pleura. Maybe, or if I put my hand on someone's head and they start twitching right away, that's going to be something to do with the cranium from a structural point of view, or the actual brain tissue itself. So it just gives me an idea of where to start. And then I get them on the table, and at that point, it's a very fluid, organic process. I used to teach these techniques at a college, and I used to tell the students, and I try to remember this every day, have no diagnosis in your mind when you first start off. Let it be wide open. Let the body speak to you, and listen. And if you've come up with a diagnosis in the first 5 minutes, you're probably wrong, because we're so multi-layered. And then so we treat for that remaining hour. And then at that point, we have a discussion of how they'd like to proceed. I tell them what I found, what I think might be going on, and then follow their lead.
So an hour and 20 minutes, and looks like there's many different levels to that connection that you're having, and be giving the patient the space to communicate with you, and you're obviously getting a sense of how they're feeling and what their energy is like. That sounds very, very different to a 7-minute doctor's appointment that somebody might have.
Yeah, and that's true. In all fairness, one thing when people mention this to me when we're working together, what I mention to them is, if I'm having a heart attack, don't come and see me. You go to the emergency ward right away. I want the adrenaline. There's a place for all medicines.
Yes.
Where our system in North America excels is in the acute. What we have in North America here is we don't have healthcare. We have health crisis management, which is wonderful if you're having a heart attack. If you've broken a leg in the middle of the street, it's wonderful. But for chronic things, that model starts to fall apart a little bit. And that's where other people can step in, like myself. And I'm a big believer in traditional Chinese medicine. There's Reiki, there's Alexander techniques, there's Rolfing. There's so many other things that can go in and look at the chronic problems and then help balance that out. That 7-minute intake can be very useful, or it can be a complete waste of time.
Absolutely, and there are obviously so many different practitioners out there that can offer many, many different things to people. And I like to think that so many people can connect with nutrition or chiropractic or herbalism. But the thing for me was, as you say, the chronic health issues that most Western countries have. People are stepping right into a doctor's office immediately, and kind of expecting a magic bullet or a quick diagnosis to recognize what I am feeling is something, and this is what I can take to help with that.
Right.
And then there's the conversation of whether a pharmaceutical drug is actually healing or treating or curing somebody, rather than the word we've used today quite frequently is suppression.
Right.
There's a big difference between those things.
There is. And again, if I'm having a heart attack, I want the drugs. But there is, again, I mentioned earlier in the show, the 5 levels of penetrations of toxins going into the body. The level 3 is where the toxic load on the body has now started to wrap around the cell wall. That's level 3. And those cells at that point, all cells have portals. Stuff has to go in, stuff has to go out of the cell, and that becomes impeded. So that cell now starts to grumble. That person won't have anything that's diagnosable with a Western term, but they'll have things like a headache, maybe a little bit of a backache, bit of a headache. They'll have low libido. They're waking up in the morning not feeling very rested. Those are all subtle signs that something's going wrong in a cellular problem. And if they go to their doctor or they go to the pharmacy and they get something to suppress that, you're basically putting in more toxic load. And then so level 3 then progresses to level 4, and that's where the toxins have now gone inside the cell. Now the cell's really screaming, and now you've got probably something diagnosable. You've got MS, you've got Crohn's, colitis, IBS, you've got dysmenorrhea, you've got something. And again, if the person then uses more toxins, more chemicals, more pharmaceuticals, you may get a an easing off of those symptoms for a while, because the chemicals are going to force the cells to do something different, but you're putting more of a toxic load in there. And my job is partly to recognize what level they're at and really hope they don't get to level 5. As I mentioned earlier in the show, level 5 is now where the mitochondria, essentially the computer of your cell, is getting really confused. And when that happens, all heck breaks loose.
This must be a trickier place to come back from. Level 5.
Yes.
Yeah.
When I do work with people with cancer, and one of the first things I have to figure out is, are they willing to make the changes necessary? Are they willing to make the changes to the things that brought them there to get them out of there? And I, just recently, a month ago, had a conversation with somebody with stage 4 cancer, and they were very resistant to start spending the money on organic foods. And I had to ask them, I said, do you know how many chemicals are inside an apple in North America that's not organic? And they went, a couple? I said, 48 to 52 inside the apple. You can't wash that off. And these are chemicals that are known to be carcinogens. So you are now, I said to this person, I said, you're at the number 5. There's nowhere else to go. You don't have the luxury now of looking at food as being neutral. Your food is going to be either helpful or destructive. And you got to make the choice.
Yeah, that's when somebody's in that position, that's, looking at just the tiniest things of just like even an apple. Is that going to be a medicine, or is that going to, put me in the ground earlier?
Yeah, exactly.
Cameron, I think that was wonderful. That's a great place to finish up. Excuse me. How can people get hold of you?
Well, I have a website. If they were to Google Cameron Moffatt, osteopathic practitioner, it comes up. The name of the clinic is Coastal Integrated Health, and the phone number is 250-590-8556. One thing I should mention before, just to further go down the rabbit hole of the quantum field, is that ETA Scan works just as effectively if the person's in the office or if I am working remotely. I work on people all over, I have worked on people all over the world with it. And if you're going to ask me how it works on a global way, I don't know. I cannot. I'm not a scientist, but the scan can also be done quite effectively remotely.
That's awesome. Yeah, that's obviously a very important point. You don't have to be living in Victoria to reap the benefits of this.
No, not at all.
Awesome. Well, thank you so much. I will leave contact details in our show notes so people can get hold of you, Cameron.
Thank you, Simon.
Thank you very much.
You're very welcome. Thanks for having me on the show. That was a lot of fun.
Absolute pleasure. Thank you.
You're welcome. Bye now.